Hello, dear fellows. Welcome to this research course, this free 7-day international research workshop, which is basically designed for healthcare professional. And if you are from any place of the world, you can join this and you can take benefits from this. As you know, that research is a key to success, and Scholar Studio will guide you to this success and will provide free mentorship trainings and different programs. And if you discuss that, what you will get in this. Course. Basically, this is expert-led session and it is free of cost. You can join at any time. We will do provide you recorded sessions, recorded lectures. In this specific course, we will focus from scratch. You will learn research from scratch, from very basics to advanced research writing and research work. Basically, this course is designed for those fellows which are beginners in the research and they have not that much expertise in the research. And then there is a live question answer sessions and interaction. And if you have a question, you can send us to through our contact numbers and through email. We will do respond to your questions. And this is basically for doctors, nurses, paramedics, and medical students. And if you are not if you are not doctor, nurse, or paramedical students, you can still join this. This will be basically a free course. And now we have to discuss that what we will study in this course. In these 7 days, on day one we will study the importance of research for USMLE, PLAB, and other exams. And then on day two we will discuss research methodologies and synopsis writing, how to write a synopsis, and what are the key factors that you have to look after while writing the synopsis, and designing your research. And then on day three, we will discuss literature review and data collection techniques. On day four, we will discuss the statistical analysis and data interpretation. And then on day five, we will discuss writing for research publications. And then on day six, thesis writing techniques will be shared. And we will have a different question answer session. And then after the completion of this course, we will again conduct a question answer session for you all. Now, let's move towards the course and our first lecture, which is based on research and its importance for USMLE, PLAY, BMRE, and MRCP, and how research enhance your medical career and exam success. Basically, if you look into the research in medical, like introduction to research in medical exam, basically a research is a systematic investigation which is aimed at advancing medical knowledge, improving treatment, and enhancing patient care. So after the new research and doing new research, you gain new knowledge, and this knowledge help you people in cure. And when you treat people, you do use of this medical knowledge. And why it matters for a medical licensing exam. Basically, if you have a research skills and you have research expertise, it strengthens your residency application. It also improves your problem solving skills and clinical reasoning, and it helps you to stay updated on medical advancements. Now, if we look into the types of research in medicine, there are a lot of different classifications. So we will just discuss few of them. Which first one is the basic science research, which is based on which is laboratory based, and then clinical research, which is based on patient based studies, and then epidemiological research, population studies. We also call it population study, in which we collect different data and analyze it, specifically used for disease prevalence or any other conditions. If you want to check their epidemiological aspects, you can use epidemiological research. And then there are systematic reviews and meta-analyses, which are used for review process of different aspects, and it provide you a different perspective. Now, if we look at the alternative to research, then there are few things we can discuss. Basically, authority is like accepting something as true because an expert or authority says so. Basically, alternative to research are the authorities and tradition, believing something because it has always been done that way, and common sense in which we rely on what everyone knows or what seems to be obvious. And then media myths, cultural narratives, which are different. Perpetuated by media at different times, and personal experience. If you have experienced something and something happened to you, then you accept that thing and you accept that condition. Now, while research is critical, some rely on alternative source of knowledge like traditions and common sense. In common sense, what everyone knows true, like believing that stress causes ulcer without medical proof. And then media myth, which is misinformation spread by the sensational headlines. And for example, if you If you look at the social media, there are a lot of posts about miracle cures and things like that. And personal experience, our generalizing from individual cases, like using a patient recovery proves a treatment efficacy from just one patient. So these are the alternative to research. Now, what is the difference between research and common knowledge? Basically, research is a systematic, organized, and question-driven, in which you study and raise question and then made hypotheses on that questions, then do systematic work and then answer that question. While common knowledge is anecdotal and unsystemic and often biased and without a clear question research like purpose. So basically, in research, you question things, you find answer to that questions, and then this is what we call research. So now, if we study that why research is essential for medical students and doctors, so basically, everyone knows that research is important for progress and advancement in every field, and same is the medical fields and medical students and doctors. There are certain aspects of research in for medical students, but we will discuss few of them. Now, first of all, if you look at the research, it enhances medical education and medical knowledge, and research keeps the profession updated with the latest finding, so they can easily use that finding in their practical experiences and provide better cure, better treatment to the patients, and it also boosts academic and clinical careers. If you look at the many high-ranking medical professions, they have a strong research background, and if you want to reach the high-ranking medical profession and become an expert in the field, you do have to gain knowledge about the research, and it will definitely enhance your skills. It will definitely help you achieving greatness in your fields and achieving making name in your field. So basically research is very compulsive for that thing, and it also develop a critical thing. Like when you study something, you do research, you think about the many aspects of that thing, like it helps doctor to evaluate the validity of study and implement evidence-based medicine. So basically it develops your critical thinking, and you think over a question, you try to answer that question by doing different research, collecting data and all these things. So it definitely develops your critical thinking, and it improves diagnostic and treatment approaches. And if you look at the improvement in diagnosis and treatment approaches all over the world, it is basically due to the research, because some of the scientists, some of the medical field experts have done research on something, they have made new disease or suggested a new treatment, suggested a new diagnostic technique. This is the thing that are helping patients in curing in cure. And if we discuss these things, that why research is essential for medical student and doctor, if we have discussed that it definitely improves your medical knowledge, it can boost your academic and clinical careers, and it develop critical thinking and improves patient care. Now, if we further discuss these things, like how it enhance your medical knowledge, how research is helpful in enhancing your medical knowledge. Basically, research keeps professional updated about the breakthroughs, like CRISPR gene editing, and for example, if you understanding messenger RNA vaccine mechanism improve patient counseling. If a doctor is doctor do understand the vaccine mechanism of messenger RNA vaccines, then he can easily tell these things to the patient and counsel the patient. These things help in this medical knowledge is basically helping you and general population. And how it strengthen the and boost the academic and clinical career. Publications strengthen your CVs for residency application in different countries like USMLE, PLAB, and other countries. So basically, if you have a case report, let's say in an EGM, and it can elevate your profile, and then it also develop critical thinking. If we look at different evaluation of study validity, like you do choose RCTs, randomized control trials, and observational studies, and you do find, and for example, if you are identifying bias in a drug trial, find it by its manufacturer. So you do use do think about these things and develop critical thinking, that how you can develop these things and improve patient care, because guidance on evidence-based decision, like if you know about the diabetes diagnosis or management of WHO, and you have studied new article, new studies in the field of diabetes, and there's a patient of diabetes, then you can easily consult them, you can easily tell them a lot of things about, and this is the thing that it improves patient care and definitely it will help the patient. So if we study the role of research in residency and job applications, for example, in the US, for USMLE, research publication significantly improves your chances of securing competitive residencies. If you have a good research skills, if you have done research, you know about the research, you have publications, it will definitely improve your CV, and it will definitely improve your chances for selections of match. And in the UK, if you look at the PLAB, it is basically not a requirement, but research can enhance your NHS job applications. Definitely, it's the same criteria that if you have research, the place where you are applying, they know that this person is familiar with the research and can do research, can conduct research, and can do these things. So definitely, it will enhance your CV in basically in UAE and Gulf countries. Some residency programs in Middle East, they do prioritize the research background, and if you don't have research background, they will not select you. And if you do have research background, you will get edge for that thing. And if you look at globally, research is the key to academic and consultancy roles worldwide. If you want to join jobs or do job in the academia, or you want to join the academic position, you must have a research background, and it's compulsory for anyone in the medical field or the other academic fields that you do have a research background and you do know about research if you want to improve, if you want to succeed in the field. Now we will discuss the different terms and different details about the specific exams like research and USMLE, which is United States Medical Licensing Examinations. So basically, research helps you in residency match importance. If you have a strong research background, like we discussed earlier, it will be a deciding factor, especially for international medical graduates who are approaching USMLE and applying for this USMLE and appearing exams. If they do have a research background, it will be very easy for them to get a match and to get job. But they don't have, if a doctor don't have a medical background or he doesn't have any research publication, that it will become difficult, or it becomes tough for the medical graduates to get jobs or get matched without research. So some of the value type of USMLE research candidates, like if you have conducted clinical trials or case reports or systematic reviews and meta-analysis. So these all things will help you, and these all things will provide you edge while selection process. And what are the specialties? There are dermatology, neurosurgery, cardiology, oncology, internal medicine, so on. There are different specialties that prioritize research, and you do have research. Even look at any field, at any specialty, you must have a research background. And now there is a question that how to get involved in research for USMLE, and the easiest way to do research or to get involved in research for USMLE is to reach out to professors and research in medical schools, and do collaborate with them, do work with them, and join research internship programs in US and abroad, and anywhere where you get opportunity to learn about the research and collaborate in research or do become part of a research. You can easily get that opportunities and do become part of this type of opportunities, like we are offering this course. So after studying this course, you will know about the basics of research. You will be able to define research and differentiate between different research types, and you will be able to write synopses and all these things. So these things helps you to improve your research skills. There are a lot of different programs and free courses. You can opt for them. There are also paid courses and certificates. You can also opt for them. So it's basically up to you. But these things do provide you uh, research experience, and these things help you in match and other exams. Now, if you look at the UK exam, which is a research and PLAB, and which is Professional and Linguistic Assessment Board UK. There is a question that is research mandatory for PLAB? No, research is not mandatory, but it definitely enhances your application for NHS position. And now let's discuss that how research can benefit UK medical career and or benefit medical graduates who want to pursue his or her career in UK. So basically, it strengthens your CV when you are applying for foundation year and specialty trainings, and it increases chances of selection for clinical attachment. So basically, in the modern or developed countries, they do focus on research because they are working on different projects, and if you join any of the institutes, you do have to work on different projects, you do have to study different things, and do get involved in different research projects. So research experience is basically compulsory and necessary. And how to build a research experience for PLAB, this is the another question. And there are certain ways, like we discussed with in the USA details, that you can join different research courses, different research seminars, and collaborative opportunities for research. And you can also join research teams at teaching hospitals in the UK or anywhere. If you are in different countries, like anywhere in the world, you can join different research teams in your own country. And you can publish a case reports, like if you are a medical doctor, you are doing job in hospital and there is a case, and you do have study about that case and you want to work on that case. So you just have to work on that case reports, and you can do literature reviews on NHS relevant topics. These all things will help you to secure a good job or to secure get a better position. So if you discuss research and EMRE, which is basically Emirates Medical Residency Entrance Exam, so why research is important for EMRE candidates? Basically, some of the USC residency programs require research experience, and if you don't have research experience, they will not select you based on your. And they do prioritize those candidates who do have research skills, who do have research knowledge, and they have knowledge about the research, and they can easily conduct research. They can work on different research projects. And definitely, exposure increases the chances of getting into competitive specialties. Like if you want to go into cardiology or any other specialty, which is very competitive, and there are a lot of candidates, and toppers are trying to get in that positions, and you are applying for that thing. So you do have a research background and you do have a research exposure, then it will definitely increase your chance. And there is again a question that how to discuss or how to gain research experience for EMRE. You can collaborate with local medical universities in the UAE or anywhere in your own country or anywhere. The world is a global village. You can connect to anyone in the world, anywhere. And the best thing is to work on retrospective studies and case series if you are working in any hospital or doing any job where you have a contact with patients, and you can easily work on that things. You can easily work on that. And if you don't have that opportunity, you can work on systematic reviews, meta-analysis, and all these things, and collaborate with different groups to enhance and increase your research exposure. So basically, research and MRCP, which is membership of the Royal College of Physician UK. The role of research in MRCP is MRCP candidates pursue research to qualify for higher academic position everywhere in the world. If you want to get to higher academic position or clinical position, and you want to be the expert of the field, you must get knowledge about the research. You must be aware of the research. And if you discuss that how MRCP applications can be get strengthened by research, basically, if you publish articles in peer-reviewed journals, that can improve the credibility of your work. And research skills will help in completing MRCP passes and written exams. And the pathway to get involved for MRCP exams is to conduct audits and quality improvement projects, participate in medical research conferences, medical research courses, and different research projects. Now, if we discuss that, what are the types of research that medical student can, and doctors can do? Like you have gained some knowledge about these things that yeah, research will help me in my different applications in different selection processes. But what are the types of research that a medical student can easily do? So let's discuss these things. The first one is clinical research, which are the direct study which involve patient data and clinical trials. You do study some patient, like you are following some patient or a single patient on a case report, or you are setting a clinical trial. That's you can do. A medical student can easily conduct clinical research and basic such research, which is laboratory based experiments to understand disease. You are not involved with the patient directly, but you do collect data from them. You do collect samples from them and then analyze them in the laboratories for research. And epidemiological research, which is related to public health and disease pattern study. And after the COVID, epidemiological research have been very important, and a lot of countries are working on these things. because it do tell you the disease pattern, and the world want to know about the modern new disease in advance. So that's why epidemiological research is very important in this perspective. If you want to improve the public health, if you want to know about the disease pattern or prevalence rate or all these things, so you do have to do research, epidemiological research, and there are systematic reviews and meta-analyses. Basically, systematic reviews and meta-analyses are the types of reviews, and it is basically used to analyze existing studies to provide strong evidence, and systematic review is qualitative work, and meta-analyses are quantitative work basically. So this is the basic difference between them. We will do discuss this different types of research and these things further in our course when we move to the next lectures and in upcoming days. So, and then there are case reports and case studies. You report unique medical cases and medical conditions. You can work on that, and that case report and case series can be published in different research journals which are specifically related to case series. There are journals which do publish only case series. Now there are other types of research, and if we study the examples of these things, like you are doing clinical trials, and you are testing new drugs or therapies, like for example phase 3 trials for cancer drugs and things like that. You can set up clinical trial research, and case reports you do document rare condition. For example, there is a 12-year-old with triple X syndrome, and it is very rare condition, so you do recommend that thing, and this is a case report. Or there are other disease which is not common in that place or that area, that locality. So you can do work on that specific cases, and there are systematic reviews which do analyze the existing studies. Like if you want to study the efficacy of telemedicine in rural areas, a systematic review, and you do work on that. You have to gather the already published data on the efficacy of telemedicine in rural areas, and then qualitatively analyze the data, and then write a systematic review about that thing. So, and then epidemiological study which do track disease patterns. For example, if you're working on rising diabetes rates in urban Pakistan or anywhere in the world, you are working on some specific disease, you want to know about the disease pattern or prevalence rate. So all these things you can do epidemiological research. Now, basically, the benefits of research for career growth. What are the benefits of research if you do conduct research, if you do work on different research projects, we publish different research papers, how it benefits you, and how it enhance or it improve your growth in career. So basically, the research enhance residency and fellowship application. This is the main target of everyone, to get good residency and get good fellowship, and it basically demonstrates the analytical skills and commitment to medicine. If you are working on cardiology and you want to do research, and you want to do work on in cardiology field, and you don't have articles in that specific field, it will be difficult for you to get fellowship or residency. But if you are applying for some certain specific field like cardiology or neurology or any of your choice, and you do have research publications, you do have research skills in that field, and definitely you will be you will qualify, and you will be considered for that position. So it definitely research improves your skills and commitment, and it also improves patient care, because if a doctor is up to date and he knows about the latest medical advancement, he knows about the latest medical treatments and things, so it will definitely improve the patient's and facilitate the patient, and will improve the patient life quality and care, and it also develops leadership and teaching skills. Now, let's say if you are working in a clinical area and clinical research, and you are on clinical side and do handle clinic, you are working in a hospital and looking after patients and doing all these things. Now, you have developed research skills. After the development of research skills, you can then move towards teaching and into academic position. You can teach in different universities or medical schools, because in different universities and medical schools it is very compulsory to have research skills, because there you will be supervising different students in their research and projects. So the research skill is very important for growth of and development of leadership and teaching skills. And if you want to move to an academic position in future, you must be aware about the research and you must have knowledge about the research, and it also expands professional network. How it expand your professional network? Basically, when you collaborate with different medical experts and different field experts on different research projects, it enhance your skills. You contact with them, you do collaborate with them, and after that you can work on different fields or different projects in future. So it expands the professional network, and you can have links in different countries which will help you in your future work and your future studies. And then uh, what are the steps to get involved in medical research? Like, we have studied that different countries do prefer those candidates which have research skills, which do have research knowledge, or research, they know about the research. But how to get involved in medical research? What are the steps to get involved in medical research? It's very easy process. The step one is to identify the research interest. Now, first of all, you have to decide that what are the topics or what are the specialty you want to pursue your career in. You want to develop your expertise in some specific field. You have to identify that field and identify that research interest, that you want to do that thing, you want to do work on that specific area. If you are working on cardiology and you have research interest in cardiology, then you have done the step one. Let's say you want to work on cardiology, so you have done the step one, which is the identification of your research interest. That and how to identify that, if someone is puzzled that how to identify my field of specialty and how to select this field of specialty, there are certain ways you can even select your field of specialty based on the market value, like what are the fields in which more opportunities are present and more growth opportunities are present. You can also do these things, and you can also select some field which is in which you are really interested and you want to pursue career in this in that specific field. Now, after completion of step one, you have selected and identified the research interest. Now, the second one is to find a mentor. Now, how to find a mentor? If you are studying in different research institute or different medical college or university or anywhere, if you are enrolled student and there will be faculty member, you have to approach the faculty member and research in your institute, and do tell them that you want to work on that specific field, you want to do research in that specific area. You have developed some work, you have developed some research proposal, you can share with them, and then you can start working with them. So this is the second step. If you are unable to find a full-time mentor for you, you can also choose opt for a mentor. Like, you can get a mentorship from different country of your same specific field area. You can also get different mentorship opportunities in different research. So this will definitely help you to improve your skills, and the mentor will help you and guide you to do your research. And the step three is to join research groups and conferences. Now, you have selected your area, you have identified your mentor. Now, you have to learn about the research. For that purpose, you have to join different research groups and conferences. You have to participate in medical research organization, do take a part in active part in different research conferences and research seminars. It will enhance your research skills. It will make you able to be updated about your field. And now you have done all these things. Now the fourth step is to conduct research and collect data. Now you want to do a clinical or lab-based study or whatever study you want to do. Now the fourth step is you have identified your field, you have identified or found out your mentor, you have joined different research groups and conferences, and now you have learned about research, and the mentor will help you to learn about the research, different research groups and conferences and courses. Just like this course, these things will help you to learn research. And then now you have to conduct and collect data. You can get engaged in clinical or lab based studies. You can get engaged in different research projects, different opportunities. You will be getting different research opportunities, and you can easily opt for them to learn about different research and conduct research. Now, the step five is to publish and present your work. Now you have done everything. You have conducted research, collected data. Now you have to work on the publication of your research, and then presentation of your research. If you have a completed research and you have not published the research, it is all in vain, and it will not benefit you. you must have to publish them in well-reputed journals, research journals related to the field of your interest or related to the field in which you have done research. So after publication, your article will be published online, and you can use that article for you to present anywhere your work. Like there are research seminars and research conferences, and you have published an article. Now you have to submit abstract to that conference, and if you get selected, you will present that abstract and that work, that research work in different seminars and different conferences. And there are a lot of opportunities in that conference, in that seminars. If you have done some new work related to cardiology and presented in some research seminar or research conference, maybe some of the participants in that field, in that seminar may or conference may collaborate with you in future projects, and this all will help you to increase your PR and get involved more and more in research. So all of these things are very compulsory. Now, if you want to find a mentor, you can approach professor or senior doctor with aligned interest, just like you, and start small, join ongoing projects like data collection for a clinical trial. Or there is a small task in any research, and they want to review some article. So one of the group wants to collect some clinical data. One of the group want to do some short type of analysis. You can get involved in all these things to learn about different things, and then you can also publish case reports if you are working in different medical teaching hospital, or you're working as a medical doctor anywhere in a hospital, and there will be a lot of patient, and if you see that some of the unique cases during your rotations, you can do document that case, you can do work on that case. And about case report study, we will do present as the full complete course on case reports to make you understand that how you have to collect data for case reports and how you write the case reports. And then attend conferences like present poster, for example, CP's panel conferences or anywhere conferences in the world. You do have to submit your abstracts, your published articles data, and you can also use free tools like Zotero for reference management, Google Scholar for literature search. So there are a lot of sources, a lot of skills you can learn while in get involved in research, and it will be a fun to get involved in research. Believe me, research is one of the most easiest thing in the world, and anyone can do this. Anyone can do research. Anyone just need to be able to work on him or herself, and make sure that they get in touch with the research, and they do participate in different research. It is not necessary to learn everything at once. You just have to take part small steps, start small, and then one day you will be a complete researcher. You will know about the research methodologies, you will know about the write up, you will know about publications and everything. So basically, common challenges in research and how to overcome them. We will talk about these things that so first of all is lack of time. Yeah, this is a major problem, lack of time, and no one has extra time, no one have time. And if you look at the medical profession, basically, specifically, if you talk about the Asian countries, and the doctors are overloaded by research, by their patients and patient burden and hospital work. So they don't find time, and this is the major challenge that medical doctors have, that they don't have time, they have lack of time. So what you have to do, if you want to work on some specific research, you have to manage workload by setting research goals and timelines, that I have to complete that questionnaire, I have to make that Google form in 2 days, and you have to mark the calendar and then do complete that task, and then another task, and then another task, and do small steps and do small, and then one day your research will be completed. And the second thing is common challenge is finding a research mentor. You can reach out to professors and attend research workshop. There are a lot of professors who visit the different research workshops, research conferences. You can discuss your ideas with them, and you can find mentor for you. You can also reach out to your professors and tell them about your research work, tell them that you are enthusiastic and you want to learn about research. They will do help you to be able to learn new research things. But if you are unable to find a research mentor, you can opt for online teaching, online mentors like from different countries, from different regions. And the third thing is that third common challenge is that understanding research methodology. Basically, there are different methodologies used for different research, and if you have research skills, you can take online courses or attend different research trainings for that thing to learn about the different research methodologies. And then publishing papers, which is also a common challenge. You can start with case reports, collaborative collaboration with experienced researchers, and learn in stepwise process. That first of all, you want to learn, you learn that how to write an article, and then then with time you will learn that how to submit the article to the journal. We will also discuss these things in detail, and we do have one separate lecture on this publication of articles things. So these are the common challenges, and you can start with case reports, you can collaborate with experienced researchers to overcome them. Now, what are the research ethics, and what are the best practices? Research ethical consideration in medical research, which is very compulsory thing, and if you want to do any type of research in medical field, you do have to get ethical approval for your study anywhere in the world. If anyone you want to do research, they must provide the ethical approvals, they must get ethical approval for their research. Even if you are working on animals research, you must follow the guidelines and do get ethical approval. You can get informed consent from patient if you are working with humans, or you are working on humans. You must have to get informed consent from the patient, that why are you, in which you will discuss that you will inform the patient that why are you collecting this data, how this data will be analyzed, and for what purpose this data will be used. You have to do provide them these things, uh, and take informed consent from the patients, and then you have to follow guidelines for human and animal research. And then avoiding research misconduct, like data fabrication or plagiarism. You have to avoid these things if you want to become a good researcher, and do ethical research, and maintain transparency and honesty in results. You have to report the results which are, you don't need to be to manipulate the results or fabricate the results in order to get the favorable results. You can easily submit that result which are with you. And the best practice for conducting quality research is to use appropriate study designs. You have to use the appropriate studies designs, and follow statistical guidelines for the data interpretation. Now, these are the basically research ethics and best practices. Now, if we look at the other things, that research and best practice, if we look at the ethical declaration template, uh, you have to declare that I declare this work is my own, all sources are properly cited, and no unethical practice are used. And the research, if we what is evidence-based medicine? If we look at the research and evidence-based medicine, the practice of making clinical decision based on the best available research is called as evidence-based medicine. And how research contribute to evidence-based medicine? It provides reliable data for guidelines and treatment protocols. You can get easily data from for guidelines about different reliable data and treatment protocols. And example of research influencing medical practice is the antibiotic stewardship programs and new treatments for chronic diseases. So basically, if we do discuss the evidence-based medicine integrates with the clinical expertise, patient values, and the best research evidence into decision making. And if we discuss that how research supports evidence-based medicine, now, first one is the guidelines. For example, CDC antibiotic stewardship protocol based on meta-analysis. You have get that things, you can work on that. And then another thing is a treatment protocol, which are used exampling, for example, using dexamethasone for severe COVID-19 after recovery, trial findings and diagnostic tools. For example, adopting AI-driven imaging tools validated by peer-reviewed studies. So you can use that things, but it must be valid and it must be evidence-based and supported by peer-reviewed studies. And if we discuss the future of medical research and AI in healthcare, future of medical research and AI in healthcare, and the role of artificial intelligence in medical research. AI-powered diagnostic and predictive models are used in research, and through AI-powered diagnostic and predictive models, we can diagnose different conditions, and we can predict different disease from the predictive AI predictive models. Basically, AI is very helpful in this research field and improving day by day. AI models are used, and emerging research field in medicine is the genomic medicine, personalized treatment, telemedicine advancements, all these things. So AI is basically used nowadays in healthcare to make sure that we do timely diagnoses, and we do use predictive models, and even robotic surgeries are also in process, and in different countries the robotic surgeries are conducted. And how medical students can prepare for future of research. If you want to be to learn about the future of research, like all you know that bioinformatics and data analysis and AI driven healthcare projects are very are on peak these days, and a lot of industries are funding for this program. So you can do participate in this type of programs and take participate in this type of courses. So, what is the future of medical research and AI in healthcare? AI in research is AI if we look at the diagnostic role of AI in research. So, AI algorithm can detect tumors in radiology images like Google DeepMinds, and predictive models like forecast disease outbreak by using big data, just like COVID-19 spread modelings, and the emerging fields are genomic medicine, which is usually tailoring treatment based on DNA, and CAR T cell therapy, and then telemedicine, remote patient monitoring by wearable devices. You can monitor your patients in different areas by different AI tools or AI wearable devices. And career tip: if you want to improve, you must learn Python or for data analysis to stay competitive. If you want to develop your career in diagnostic or predictive field, or like epidemiological studies, you want to work on public health, you must learn Python or spaces and all these clinical tools to easily conduct research and easily do research. So basically, if you discuss the conclusion and final thoughts, so today we have studied that research plays vital role in medical education and career development, and strong research experience can boost application for USMLE, PLAB, EMRE, and MRCP, and all different exam taking place over the globe. And engaging research will enhance your clinical decision making, and evidence based practice, and you can do practice that things. And now the last thing is to take action. So to take action, you have to start from a small, find a mentor, and contribute to medical advancement. And yeah, if you contribute to the medical advancement, you will be remembered for that thing. And your contribution, like we study today, we study that scientists from past have contributed to research, and we do honor them. We do honor them. We do discuss them. So yes, this research things will help you, and for that thing, if you don't know about the research, today's lecture was very general about different concepts and different things to make you sure that you do understand different concepts about the research, you do know about different perspectives of the research and the importance of the research. And then from next sessions, we will do focus on specific topics like synopsis write-up, article write-up, and all these things are coming up the way. So we'll catch you in the next lecture. If you have any question, drop your questions. We will respond to you. Thank you and goodbye.